In Washington, D.C., catching up with Dr. Tony Cirillo, president of the American College of Emergency Physicians. Why are you here in D.C. this week?
I'm here in D.C. to take the voices of our 40,000 members and bring them to Capitol Hill, where we know there are people here who are making decisions and policy that affect how we take care of patients every day.
You have a long list of meetings. How are they going so far?
The meetings are actually going very well. Our story, your story, is a very easy story to tell, and it's a compelling story. And when we talk to members of Congress and staff who are going to make these decisions, even the ones who haven't watched the pit, although we highly encourage that, they understand that we are taking care of people in challenging circumstances in a broken system. They know that. What they're looking for is how they can help us. And so what we're bringing here are solutions to some of the common problems, the things that we feel every day: boarding and crowding, workplace violence, and reimbursement issues that are threatening our practices every day. We are here to have conversations with the people who can make that better for us.
And how are those conversations going? And by that, I mean, what are they saying to you about all of this?
They're asking for, give us examples, give us stories that we can use. Tell us exactly what it is that's broken so that we can help fix that. And we are offered to help them in two ways. One, with our stories, which no one else can bring to the Hill. And then with data. And we're going to try and help them by bringing information and data about our practices and about how we take care of patients so that they can both feel and understand the reality that we're in and how they can help us.
I know we've caught you early in this trip. You have many more meetings to hold, but are you feeling good about the ones you've had already?
I am. I want to give a big shout out to the ACEP staff. They are really great in terms of getting us prepared for these meetings, and actually they have great relationships with the members in the offices. Those relationships, not just from one president, but from the people here who are our voices 365, are critically important. And so the meetings are going well, and I'm very optimistic that we're going to give these members of Congress a reason to help us and ways to do that.
And you've got to be up here. You cannot leave this audience unattended. You need to make sure they know what's important, because that's what members need.
Decisions are made every day. The question is do we want to be there helping to inform the people making the decisions or not? And others, like insurance companies, are here all the time. And so our voice, your voice, matters. And if we don't know what's important to you, I can't bring those stories and that message to the Hill. So for every emergency physician, and particularly for every ACEP member, please know your voice does matter and your participation in this process matters. Relationships and spending a little bit of time with your member of Congress and your elected officials and their staff makes a huge difference in having them understand who we are, what we do, and why it's so important for them to help us.
Dr. Cirillo, ACEP president, thanks for the time and good luck with the rest of the schedule.
Thank you, sir.